Hey, again, this is Millicent St. Clair here at the RAADFEST in San Diego, California, and I'm talking to Dr. Steenblock about his amazing program called Stemgevity. And we were talking a little while ago, and I shared with you when I saw the information about ALS that my first husband died of ALS, and it was over a 10-year period, and there was absolutely nothing anybody could really do to help us with that. Can you share more about your product, Stemgevity, and what you're up to these days?
Yes, for the last, well, let me just start. ALS, or amyotrophic lateral sclerosis, is a scourge of anybody and everybody that ever wants to stay alive and healthy. You sure don't want to get this disease. And the problem is that nobody up to recent times has been able to say anything about what it's caused by. They've studied anything and everything, viruses, bacteria, you name it. They've looked at it, couldn't find anything. So there's been nobody who's come up with anything. There've been over 180 different drugs tried on this in double-blind control studies. Absolutely nothing. They spent billions of dollars on it, and there's absolutely nothing coming up, and there's nothing on the market right now, or likely to be, because of the fact that they don't know what they're doing. And some years ago, back in 1978, 79, I had my first case with ALS, and this was a 46-year-old Indian lady who had arthritis from the top of her head down to the tip of her spine. And I said, God, this spine is just horribly messed up with osteoarthritis, osteophytes, calcium deposits, and it's got to be some relationship to this ALS because the spine is involved with ALS. And I talked to the neurologists and the neurosurgeons and the orthopedic surgeons, and they all said, no, it has nothing to do with anything because there's no compression of the spinal cord. You have to have some kind of spinal cord compression to have disease in the cord. So all this arthritis this person has nothing to do with the spinal cord and this ALS disease. And I said, gee, that's sure funny. It sure makes sense that she's got all this arthritis, and yet you're telling me that it has nothing to do with the spine. It's like all this disease around the cord, and it's squeezing it and doing all these things, and there's no pathology from it. Nope, no pathology. Don't have to do anything about it. It's not going to do anything. Well, okay, so I went on, but I kept that in my mind, and I kept seeing patient after patient with the same kinds of symptoms, the same kind of arthritis, and finally I started about 4 or 5 years ago. I got involved with a chiropractor, and we were talking about doing disc disease and how to fix disc disease. And one of the things that part of it, we started looking at the molecular biology. It turns out that whenever you have pain in the spine or spinal areas, in perimuscles and perispinal muscles and the fat and all that, the tissue generates a thing called tumor necrosis factor alpha. And that tumor necrosis factor alpha is very damaging to the spinal cord. And then so that diffuses into the spinal cord. That's one right there. Parkinson's are involved with that, and Alzheimer's, MS. There's a lot of different diseases have tumor necrosis factor as part of the disease process. But anyway, that got me started on this whole relationship back again because I had kind of put it aside. And so I started looking at it, and I started studying ALS patients more carefully and found out that not only did they have tumor necrosis factor, but they also had, many of them had intestinal mucosal damages, and sort of like a Crohn's disease. And when I studied them even further, I found that almost everybody had a yeast infection. And then I started looking at that, and then I did CAT scans on like 54 patients with ALS, and 52 out of the 54 had what is called spinal neuroforaminal stenosis, in anywhere from C3, cervical spine 3, 4, 5, or 6, and 7. Any of those areas you can have a nerve being squished by this osteoarthritis from the degenerative disease. Now what happens is that the younger person who's a football player or a soccer player or something has a car accident in his 20s, in his teens, he'll get this pain. I had a patient here that just asked me this question. He's now 20-some years old, and he had a whiplash, and he's been having pain in his neck now for years already. And if you do and he hasn't had a CAT scan, I said, well, we need to do a CAT scan because CAT scans tell how much calcium deposits there are. And so the calcium deposits contribute to this neuroforaminal stenosis, and calcium causes poisoning of the nerves. So now you have nerves being poisoned by the stenosis, the narrowing, and by the calcium deposits. And if you have a yeast infection in the gut, that yeast the debris from the yeast is carried by the blood to that into that spinal cord, and that's how this whole process goes. And at autopsy a year ago, 100% of all ALS patients have yeast in their brain and in their spinal cord, which ties it all together. And on cerebral spinal fluid analysis, I measure the spinal fluid and find endotoxins, which are poisons from the gut, in the spine, which again contributes to the fact that what I'm saying is true, that ALS is caused by a chronic infestation, generally of the yeast in the gut, being transferred to the cervical cord, and we have injuries in their teens, and then you have another injury 20 years later, and that secondary injury where you twist it again, hurt it again, that's what triggers the whole disease. And I've had patients with one day, they have injured their neck one day, the next day they get ALS. And if it's on the spinal nerve is on the right side, the paralysis starts on the right side. If it's on the left side, the neuroforaminal stenosis, it's on the left side. So this is how you do it. So how to treat it, you have to treat the spinal nerve injury, you got to treat the fungus, you got to do all these things, and then you got to try to repair it all. So knowing the etiology is great, but we're still working on cleaning up this debris and everything. Anyway, so now.
And we need more than just bucket challenge, which I love because that brings awareness to this issue. But tell us what solution that you're offering.
Well, for ALS, you got to do all those things. Stemgevity is a stem cell mobilizing product that I put together that mobilizes or takes your bone marrow stem cells out of your bone marrow, throws them into your circulation, and then that carries to your nervous system and helps with the repair process. But if you can't, it doesn't kill. It has some antiviral, antibacterial effect, but it's not enough to kill off all the bugs in a person like ALS or anything. So it works with stem cells too. So 3 of these a day enhances your own stem cells to grow most efficiently. So my patients that I give stem cells to, I do bone marrow stem cells and whatnot to people with ALS and put them into the spine and whatnot to help them get better and have pretty good results with that. But again, you need to have the whole comprehensive, holistic approach to it. Stemgevity, for example, I had a patient in last week with a stroke. He had taken this for 1 month, and he was just ecstatic about the results. His mobility had improved, his spasticity had improved, his pain had gone down, and he was very, very enthusiastic about it. And I've had that over and over again. Lots and lots of patients have good results with this, more so than my practice of medicine, frankly.
Got it. Now, I know quickly the people are very ignorant about stem cell research and really what the true benefits of it are, or the reasons why this is so controversial. Can you tell me more about why people are so resistant to the whole stem cell treatments and modalities? Why are they resistant to this new paradigm of treatment and healing?
I think it's just mostly ignorance and confusion because we have the embryonic, you have embryonics from test tube baby kind of things, and then you have embryo from aborted fetuses that are 2 months old or less, and then you have adult, which are umbilical cord blood. And so anytime the baby is born, now it's become an adult kind of thing from a stem cell point of view. And then you have your adult, like you and I have stem cells in our bone marrow and in our fat. And the older we get, the less effective our bone marrow and our fat stem cells are. And a part of it is that as we get older and older, not only do the telomeres of the stem cells get shorter and the telomeres of your body gets shorter, so you don't replicate and don't regenerate, but the growth factors also decrease as you get older. I did a study with umbilical cord blood, compared it to a 90-year-old. A baby's blood at birth has about 10,000 micrograms per deciliter of growth factors. A 90-year-old has about 100. So 10,000 versus 100. In other words, a 90-year-old has virtually no growth factors, and you cannot repair yourself with no growth factors. The only way to get really good results is lots and lots of stem cells, because stem cells make growth factors too. So either you give a lot of growth factors and healthy stem cells, or you just keep on getting worse and you die because of all these different problems with aging.
So this is one of the solutions that you're offering, one of the many, Stemgevity, which stimulates my own production of stem cells inside of my body.
Right, and it releases them into your system and allows your stem cells to help fix you. Now, the best way to do it is to not only take this, but to take this before you exercise. If you take this like an hour before you exercise, this will work with your exercise to really mobilize stem cells. You get a lot better. Now, and then if you have a lot of hypoxia, that's another thing. Later in the day, if you take an hour or two of oxygen by mouth, that'll help enhance the healing effect too.
Terrific. You are a wealth of information. My gosh, I could go on and on listening.
Is stemcellmd.org. Stemcellmd.org.
And we are in the beautiful city of San Diego, but where are you located out of?
I'm in San Clemente, and my phone number is 949-367-8870. 949-367-8870. And if anybody needs any help, look me up on the website. I treat a lot of neurological conditions: Parkinson's, MS, Alzheimer's, ALS, and cerebral palsy. Cerebral palsy, I have a book out, Umbilical Cord Stem Cell. I was the first one to write the book on stem cells in 2006, and in that book I describe all kinds of results from the use of umbilical cord stem cells.
So quickly, these illnesses that you've just mentioned are typically associated with the elderly, but I find that more and more young people are being diagnosed with these kinds of much earlier on.
Well, whatever the case, if you got a problem that is not being able to be fixed by standard care, standard medicine, you got to remember me, because that's what I've done for my past 40 years is deal with people that have not been able to be helped by standard doctors. And so standard care is standard care. If you have a standard care policy, insurance policy, and they'll pay for your care, go to your doctor and get taken care of. But if that fails and it doesn't work and you continue to suffer, then you say, what else is there? It's Dr. Steenblock in San Clemente, California, 949-367-8870.
There you have it. Thanks, Doc.
Thank you.